Hello, how are you? My name is Arlia. I'll be your nurse today. I'm going to go ahead and perform some hand hygiene, provide some privacy for us, and verify doctor's orders. So today I'll be checking your vital signs, your respiratory assessment, and your cardiac assessment.
Okay.
So we'll be doing those three things today.
Okay.
Before we start, can I have your date of birth and first and last name?
It's Taylor Griffin, 0202-2000.
All right, so I verified that by her wrist, and let's get started with the blood pressure. That's the arm that you prefer me take your blood pressure in?
You can do my left.
Great. All right, if you can just sit back for me, make sure your legs are uncrossed. Finding that brachial artery. Also the brachial pulse. And what's your normal?
Like 110s over 70s.
110 over 70. So. All right, if you could just relax for me, it'll be a little tight.
Okay.
Okay, so I have you at 110 over 62.
Okay.
All right, just relax for me. I'm going to take your pulse and I'm going to take your respirations.
Okay.
All right. Flex your arm, please. All right, so 12 times 2 is going to be 24 for the pulse.
Okay.
Okay, just relax. All right, so that's going to be 13 for respirations. I like to do a full minute for that. Let's move on. Well, actually, are you experiencing any pain?
I'm not.
No pain. Okay, great. So let's move on to respirations. Well, actually, respiratory assessment. Sorry about that. All right, so if you could just turn this way for me, just so I can see, we can have some better lighting, okay, of what I'm actually doing. Okay. Alrighty. So, are you experiencing any shortness of breath?
No.
Okay. Alrighty. So I'm gonna go ahead and take a listen to you.
Okay.
Okay. Okay, I'm gonna go right over here. Gonna go down. Over. And I'm gonna go over here to the lateral side. Okay, if you can sit up for me, I'm gonna do the same thing on the back. Alrighty.
Okay.
So everything sounds good. So what I'm gonna give you now is called an incentive spirometer.
Okay.
And basically, if you're having any type of breathing problems at home, you could use this to help improve your breathing, anything like that. So first I'm gonna show you how to use it. So when you go home, you'll be comfortable using it.
Okay.
So what you're gonna do is tightly wrap your mouth around the piece
Okay.
and breathe in. When you're exhaling, you're gonna take it out and then exhale. So go ahead. Alrighty. So that's how you're gonna do that. You understand how to do that? And if you just so happen to lose it, what you can do is cough and breathe.
Okay.
And what you're gonna do is breathe in 3 times. That third time, you're gonna hold it for like 3 seconds, and then you're gonna cough just so we can expand your lungs.
Okay.
So let's do that together. So
Okay.
breathe in and breathe out. That's 1. Breathe in and breathe out. That's 2. Breathe in. Hold for 3 seconds. Hold 1, 2, 3, and cough out. Yes, that'll help you expand your lungs.
Okay.
Alrighty. So what we're gonna do next is your cardiac assessment. So are you having any chest pain, any tightness in your chest, or anything like that?
No, I'm okay.
Okay.
Yeah.
Alrighty, so what I'm gonna do is go ahead and take a listen. If you could sit back for me.
Okay.
First I'm gonna assess your veins. So if you could turn to your left. Okay. And we are sitting at a 45-degree angle. Okay. And then we're gonna come over here and turn your head to the right. Alright, everything looks fine. Doesn't seem like you have anything bulging or herniated or anything like that. Alrighty, so let's take a listen. First things first, your aortic. Okay. So right here I can see her collarbone, and I'm gonna go down. Right here. For cardiac assessment, it's gonna be the same thing. I'll move over to the pulmonary. I move further down to your chest down here until the herbs point. Okay, I can hear that from loud and clear. And let's go down here to the mitral valve. Actually, that's incorrect. This will be tricuspid. Then we'll go over to the mitral valve. Okay. So I'm gonna go ahead and check for the different pulses. So I already checked the brachial pulse. That was earlier. I would rate that one by the 2. Let's see. We're gonna go ahead and check your carotid. Okay. So I'm already on this side. So I'll just do this side. Okay. I'll rate that one about a 2 also. Let's check your left and right radial pulses. Okay. So, you could loosen that for me. Okay. And okay. Let's go over here. And they both feel the same. I'm going to go down here to the posterior tibia that's right behind the ankle. Okay. And I'm not actually sure if we should just check both of them, but that's what I think I should do, so that's what I'm going to do. Okay. Okay. And I'm going to check here. I have a hard time pronouncing this Dortilis piece. Okay. Okay. So if I didn't say already, I would rate the ones behind the ankle. I rate those a 1 because I really couldn't feel it. I don't know if it's just me or you, but I really couldn't feel it. And on top of the feet, I'll rate those a 2. Alrighty. Am I missing anything? Okay, so that seems like everything. I'm gonna check the capillary refills. That's my favorite part. And they come back in like 3 seconds. White, red. Okay. Alright, so we're all good there, and I'm going to check for edema in any of your arms and your legs, so I'll be doing both, well, all of them. And I don't know if you can tell in the video or not, but as soon as I press back in, it gets right back firm. Okay? Just leaving little fingerprints. But they feel good. Let me check your leg. Okay. Alright, and I'll do the other one. Okay, everything seems good. Alright, Miss Taylor, that completes your vitals and your 2 assessments for today. I'll get everything to the doctor and we'll get back with you.
Okay.
Thank you.